everyone. Welcome to today's question and answer session on social egg freezing. So coming to this topic, why do you think big tech companies like Amazon, Apple and Uber are offering the option of social egg freezing to the female employees? And even in India, companies like Accenture are offering to give medical coverage to women who choose to freeze their eggs. The answer to this question is very simple. It's because social egg freezing now has become a tool of women's empowerment where women do not have to choose between their career or motherhood. They can opt for both by freezing their eggs at an early age so that they can use later on when they're ready to embrace motherhood. So coming to this topic today, joining us is Dr. Ruchi Jain. She is a fertility consultant at AIJA, Kolkata. And I hope in this talk, we will be able to put a spotlight on this process and help you get a better understanding on the topic. So Dr. Ruchi, let's dive into the question and answer session today. So to start with, can you please explain the process of social egg freezing?
Yeah. So I'm sure that most of us have encountered this term social egg freezing in the recent times because of it's very much in trend now. So initially, egg freezing was reserved only for women, where in certain countries where embryo cryopreservation was not permitted by law, or as a part of fertility preservation for medical reasons, such as when a young woman is diagnosed with a cancer and she needs to undergo sterilizing gonadotoxic chemotherapy and or radiotherapy or any form of surgical intervention on the ovaries, or even some genetic or autoimmune conditions which might impact her future ovarian reserve and fertility. So, but over the recent years, as we see, there is an increasing societal trend for women who delay their childbearing or postpone their conception until late 30s or even early 40s due to certain social or personal reasons. So, this technology has actually proven to be a blessing in disguise for such women who can actually opt for egg freezing, which we term as social egg freezing, or planned oocyte cryopreservation for non-medical reasons, where they can preserve their eggs at a much younger age. And once they are financially or psychologically and mentally stable, they can actually use those eggs and embrace motherhood at a later stage in their lives. So, and also speaking about the technical advancements, so the egg freezing procedure is no longer considered as an experimental, and it has become an established option, especially with the introduction of vitrification, that is a new freezing technique over the past few years. This field has grown immensely and can be seen as a breakthrough in the field of reproductive medicine.
Dr. Ruchi, in Indian scenario, who should be going for this social egg freezing?
So, as I've already mentioned, that you can see more and more women are postponing their childbearing. And one of the most common reasons cited by these women, according to the studies, is lack of a suitable partner to start a family. Or it can be reasons like pursuing higher education or a demanding career path, that is professional commitments, and where they think that they are not prepared for embracing motherhood at this stage. So such women can actually benefit from elective egg freezing or oocyte cryopreservation at a younger age. And also, since we know that a woman's fertility declines with increasing age, so when women reach their late 20s or early 30s, they are constantly reminded of their biological clock ticking. So egg freezing actually helps them to have an empowerment and a control of reproductive autonomy by overcoming this age-related fertility decline. And once they are mentally, financially, and psychologically stable, they can later on pursue motherhood using those frozen thawed eggs.
So what is the best time to freeze your eggs, and how early should these women start thinking about social egg freezing?
So although egg freezing provides the flexibility of planning or postponing pregnancies, but again, it is very important to ensure that the eggs are banked or frozen at the right age for having successful outcomes. So, because the reproductive window in females is much narrower than in males, and after the mid 30s, the fertility begins to decline with a sharp decline after the age of 35 years, especially due to a decrease in both quantity as well as quality of the eggs. So the earlier you freeze your eggs, that is at a younger age, the better will be the results. So according to the studies, the optimal biological time which has been reported for freezing the eggs is between the ages 30 to 34, according to the various studies. So there is no upper age limit, but definitely in short, I can say the younger the woman at the time when she chooses to freeze her eggs, the better will be the live birth rates and success rates.
So, Dr. Ruchi, another question that comes in my mind is this process available for all women, as in like is everybody eligible for this? Or is there any kind of screening criteria?
Yeah. So once women seeking elective egg freezing come to our clinic, we usually begin with a detailed history and counseling by a fertility expert. So apart from the baseline investigations, it is very important to assess the ovarian reserve of the woman, which can be done through certain blood tests like anti-Mullerian hormone, or it can be a day 3 basal FSH levels and antral follicle count using a transvaginal ultrasonography, which also helps us to assess the uterus and uterine cavity and any other coexisting related pathologies. So basically, we get an estimate or idea of the woman's egg reserve so that it helps us to decide whether this is the right choice for her or not. Also, more importantly, it helps us to understand how the individual's ovarian response would be in the cycle, and accordingly we can decide the optimum dose of injections that would be required for that individual. So how safely and realistically, that means how many eggs can be obtained in a single cycle of ovarian stimulation. So after this screening process is the actual egg retrieval and freezing process will begin.
So, can you briefly explain the entire process of egg freezing, what to expect during the initial process?
Yeah. So the initial process of egg retrieval up to the freezing is actually the same as we do in a conventional IVF cycle and is a relatively safe and painless procedure and involves basically the phase of controlled ovarian stimulation using hormonal injections or gonadotropins, followed by a trigger injection for oocyte maturation and transvaginal ultrasound guided oocyte retrieval, and lastly, post retrieval assessment of the oocytes. So, to elaborate, so this procedure usually starts on second or third day of your menstrual cycle, and after a baseline scan is performed, the ovarian stimulation is initiated with daily hormonal injections. And also, I would like to mention that since the recombinant preparations are available lately, the injections are very much patient friendly and they can administer themselves or even a partner can help them with, because they can be taken subcutaneously just like an insulin syringe or pen device. And unlike the previous urinary preparations which need to be taken intramuscularly, which were more painful. So this process basically involves daily injections along with serial monitoring through transvaginal scans to track your follicular growth. So this process on an average may take around 10 to 12 days. However, it can vary from individual to individual. And this would require at least 4 to 5 clinic visits. So once the stimulation process is over, and once we see on the scan that the follicles have reached an appropriate or mature size, it is the time that we give a trigger injection to induce maturity in these oocytes, and the oocyte retrieval or egg retrieval procedure is scheduled 35 to 36 hours after the trigger administration. Coming to the egg retrieval process, this is usually done under general anesthesia, and basically it is usually safe and very much well tolerated procedure, and usually done on an outpatient basis where the patient gets admitted in the morning and can be discharged in the evening once clinically stable. So during the procedure, an oocyte aspiration needle is attached to the transvaginal probe and is inserted inside the ovarian follicle under direct vision, that is under ultrasound guidance. And one follicle at a time is punctured, and the follicular fluid, which contains egg or the oocyte, is collected in the test tubes, which are already warmed using a negative suction. So this procedure is repeated until all the follicles from both the ovaries are harvested. So this procedure usually takes around 15 to 20 minutes. And if you're clinically stable, you can be discharged the same day. Coming to the post-retrieval, so once the oocytes are retrieved, they are examined under the microscope by an embryologist and morphologically graded for their quality, and also they are incubated for some hours to complete their maturity. And once the mature eggs are obtained, they undergo vitrification, that is the freezing process, and are cryopreserved in liquid nitrogen for future storage. So, on an average, you can say the whole process, right from the start of the stimulation till the egg retrieval and freezing procedure, takes around 14 to 15 days time.
So, Dr. Ruchi, is there a good recommended number of eggs for oocyte yield? And also, I'd like to know, is there any way to increase the live birth rates via egg freezing?
So, there are various factors which impact the success rates of egg freezing and thawing procedure. And most importantly, wherever the woman is in her reproductive years, it is the number of the eggs and the age of the woman which matters the most. So the probability of live birth increases with the increasing number of eggs which have been frozen. Yes, depending on the age of the oocyte. So the higher number of eggs you have frozen at a younger age, you will have a probability or increased probability of live birth rates later on. So I would like to mention one of the studies in 2017, which was published in the journal Fertility and Sterility, which would shed light on some important facts and figures. So it was reported that women under the age of 35, when 15 mature eggs were frozen, they had a cumulative 80% chance of obtaining at least one live birth. And this chance increased to 90% when they had more than 20 eggs frozen. Similarly, 35 to 37-year age group, they needed 20 mature eggs to obtain 80% chance of at least one live birth. And for 38 to 40-year age group women, it was 30 mature eggs which were required to have a 75% chance of a live birth. So as you can see, with the advancing age, it is not only the number of eggs which are required more to obtain the similar or acceptable success rates. Because with increasing age, not only the quality suffers, quantity also starts declining. So in a nutshell, I can say the younger the woman is at the time when she chooses to freeze her eggs, the higher the likelihood that using those eggs will result in a clinical pregnancy and live birth. Under the age of 35, when you have a good ovarian reserve and the quality of the eggs is also fairly good, so it has been shown that at least if you get 15 mature eggs retrieved in your one cycle, you still have a 80% chance of having a live birth. And with increasing number of eggs, if this crosses even 20, then you have more than 90% chance of having a live birth. Similarly, above 35, with increasing age, you need more number of eggs to have comparable outcomes. And also it becomes very challenging at this with increasing age to have those number of or adequate number of eggs to be retrieved for the success rates, because the reserve has already come down by default. So also these women need to be counseled that these patients may require more than one, that is multiple cycles of ovarian stimulation and pooling of these oocytes, so that we can offer them acceptable success rates.
Right. So this is a very important point. So as your age advances, you might have to go for more than one round of ovarian stimulation and retrieval process to ensure that you have good number of eggs to achieve the success rate, desired success rates needed. So moving on to the next question, how long do you think we can safely keep these eggs in storage?
So although there is no scientific upper limit for storage duration, eggs can be indefinitely frozen for years together with the advancement in technology like in production of vitrification. But it is very important that each woman should know their legally permissible age for IVF in their country, and also the permissible storage duration for the gametes, because these factors are governed by laws and depends or varies from nation to nation. like in India, according to the new ART Regulation Act, which was recently introduced, it is mentioned that a gamete or gametes or embryos cannot be stored for a duration of more than 10 years. So it again depends on from the laws from nation to nation.
So, a good point to note that in India, if you're going for social egg freezing, the maximum term you can freeze your eggs is 10 years. So, in case if you're planning for a delayed motherhood, so you need to keep this timeline in mind when you're preparing to freeze your eggs. So, moving on to the other question that's very commonly asked is that this entire process of retrieving, freezing, and later on thawing the eggs, does it cause any kind of damage to the oocyte quality and therefore the embryo quality?
So the main factors, yes, laboratory to laboratory, the success rates of egg freezing and thawing may vary because it is also operator dependent. But if a laboratory has a strong or robust cryopreservation program, that is vitrification, with all the quality control and quality assurance measures in place, then definitely you can expect the higher success rates. So it is the laboratory conditions which will matter. But once you follow the standard protocols, the vitrification technology has dramatically improved our success rates in terms of post-thaw survival rates, which are as good as 90 to 95% compared to the initial techniques like slow freezing technique, which was used in the initial years.
So, what are the costs involved in the procedure? If you can give a breakup of that.
So coming to the costs, so the costs until the oocyte freezing procedure can be basically divided into two. So one would be associated with the ovarian stimulation, egg retrieval, and immediate freezing, that is by vitrification. The other cost would involve the cost associated with the long-term storage of these oocytes for months or years when you actually come back to embrace motherhood. So the initial costs associated with the stimulation part can vary from individual to individual, since it will depend on how many medications and what dose and for how long you need the injections. So that roughly ranges from 80,000 to 1 lakh per cycle. Coming to the second part, that is the cost associated with long-term storage. So the yearly cost comes to around, it can be a quarter of the cost involved in the stimulation cycle. And also it can be renewed 6 monthly or yearly, depending upon the individual's choice. Also, we have certain financing options which are available to help you out with. Like we have certain EMI options that can be discussed once you come down for a consultation, and we can plan according to your convenience.
Okay. So, once they are ready for motherhood, what do you expect? What is the procedure after that?
So once a woman is ready to start a family and wishes to use her frozen eggs, which were cryopreserved, so these eggs, basically after these eggs which were cryopreserved are then placed in a warming solution and reassessed for their survival. So the mature eggs then undergo fertilization using a partner's or donor's sperm, and then embryos are developed, which are cultured up to the day 3, that is cleavage stage embryo, or day 5, that is blastocyst stage embryo, depending upon the embryo number and quality. And either of this stage, embryos are transferred into the uterine cavity of the women and then successfully followed up.
All right. Okay, so we come to the end of a very interesting talk. Dr. Ruchi, if you could just summarize what we have discussed and give us the key take-home points to take away from this talk.
So to summarize or conclude, I would say that social egg freezing has recently gained popularity among young women and has gained mainstream attention, not only due to the increasing or changing societal trends, but also due to the advancements in the technology which has been made in the recent years. So it is basically a tool of empowerment for these women who can pursue their motherhood, who can delay their childbearing due to certain personal or professional reasons and embrace motherhood at a later stage by opting for egg freezing at a younger age. So social egg freezing can be seen as an empowering option that women have, a choice that they can make, and it offers them flexibility to embrace motherhood once they are ready, instead of being hostage to their biology. So having awareness about this and initiating the process at the right age and time can help you increase your success rates?
So social egg freezing is now a very important tool available for women who want to opt for their career and also motherhood, but then they don't want to they don't have to sacrifice their career goals for motherhood. And we need to have more conversations on this topic, and more people or women should be aware that about this option. Also, nowadays we are having very economical packages for long-term egg freezing, so you can walk down to an infertility center and discuss the options available. So we'll be always happy to help you out with whatever information you need regarding this topic. So get in touch with us, and in case if you have any kind of further questions on this topic, please DM us, and we will be getting back to you soon.
Thank you.